Hi, I'm Brooke. I'm a coach here at MeetRx, and today we have with us Dr. Kristin Baier, who's going to share her own personal story with the carnivore diet. Hi, Kristin.
Hi, thanks for having me on.
It's my pleasure. Now, you're a board-certified family physician and obesity specialist. Is that correct?
That's correct. Yep. Yes, I am.
And well, I'm really curious what originally brought you to the carnivore diet.
Right. So it was kind of a long journey. I can go back. I was diagnosed with lupus almost about 10 years ago. And during that time, I was in medical school and kind of saw what my future could look like on medications, steroids, and all the potential consequences of not just the disease, but of being on those medications. So I started researching kind of alternative treatments and diets that could help alleviate my symptoms. And the first I came across was a book on being vegan for autoimmune disease. So I thought, great, that's what I'll do. I'll be vegan. And I was vegan for 5 years and just acquired a lot more health problems. I started developing migraines. I had a B12 deficiency, really bad anxiety and depression that all required more medications. I developed stomach ulcers at one point. So 5 years in, I realized that's really not working for me, and my lupus symptoms were just getting worse. So I discovered the work of Rob Wolf in the paleo world, and I transitioned out of being a vegan and started including meat back into my diet. And I did have a lot of improvement there, but I was still having debilitating migraines, and my lupus symptoms were still very much a factor. Fatigued all the time, joint pain, muscle pain, skin issues on top of that. So I read another book on diet for migraines, and it was called The Migraine Miracle by Dr. Josh Turknett, and he recommended a ketogenic diet for migraines. I thought, this is kind of a crazy diet. I've never heard of this. It's high fat. What's going on here? So I kind of dove into the literature myself and realized there's a lot of support for ketogenic diets, and it's not going to kill me. I'm not going to have a heart attack. I felt confident about that. So I started keto about 3 years ago, and within a couple of weeks, my migraines were almost completely gone. And I noticed unexpectedly that my lupus symptoms had been improving as well. They weren't gone, but improved. And I just started getting more involved in the social media space and reading about other people's success stories. And I was drawn to the carnivore world based on people's improvement in their autoimmune symptoms. I thought, wow, that's really incredible. And, you know, I would have thought I was crazy 5 years ago, but when you can't argue with success stories that people are having when traditional medicine has really failed them. So about a year ago, I started dabbling with carnivore myself, and really within probably a week, I would notice improvement in my lupus symptoms. And in all honesty, oh, go ahead.
Well, I was going to ask you for that, after that first week, what were the first things that you noticed in the improvement in your
energy? My energy was through the roof. And then my joints just hurt less. Every morning I wake up with bad ankle pain specifically. It lasts a half hour or so, maybe every morning. And one morning, I won't forget, I woke up and I jumped out of bed and it was like, my ankles don't hurt. I hadn't experienced that in a decade. So that was really eye-opening. But the first thing I noticed was my improved energy, and then the joint pain. I've always had skin issues with lupus, and that starts to improve a lot as well. So, and I don't know why I'd go on and off of it for a little bit, and every time when I went off, I just went back to regular keto. My symptoms would come back. So it's really a couple months ago that I realized, okay, this is going to be my life. It's going to be carnivore. I feel better. And, you know, that means modifying things and cooking at home more. And I should preface, like, I don't own a grill, I don't cook. I was doing meal delivery and eating out the majority of my adult life. So I learned, and it's not hard to learn how to sear a steak on a cast iron skillet and cook some ground beef. So, and I'm happy doing that now, and it's satiating, and I feel a lot better. So I mean, I was surprised. I'm not gonna lie. I went into it without high expectations, hopeful, but I really didn't believe it would work, and it did. It
is amazing. Yeah,
it is
amazing.
It is, and yeah, and I've been able to wean off of medications, and it's fantastic.
What were you when you were first starting on carnivore? Were you just eating beef and eggs, or?
Yeah. So okay. So I should go back. When I was doing paleo, there's a paleo autoimmune protocol. And for that particular diet, they recommend against dairy and even eggs. So when I first started, I pretty much just did meat, steak, ground beef. I did include some salmon. And once in a while, I'd get a craving for chicken, which is weird. But I'd always do like chicken thighs or drumsticks, fattier cuts. But I'd say 90% of my diet is red meat. I don't eat a lot of eggs. I feel like I get a little bloated after I eat them. I think that's individual for me. I think a lot of people do just fine with eggs, and they're very nutritious. But personally, it's rare I have eggs. I like them, so maybe on occasion, but mostly it's red meat.
And I'm curious, when you would go back to keto, did you notice there were any particular foods that were really triggering, or what?
Yes, I cannot do any type of flour, even if it's almond flour, if it's coconut flour, no flours, and Brussels sprouts, cauliflower, asparagus, absolutely not. I can do some lettuce, some mushrooms seem to be okay, but eventually, I mean, I really just felt better not including those. But yeah, there's a lot I won't touch anymore.
Yeah, you said you just left plants behind, I guess.
Yes.
Yeah.
Yeah.
Well, good for you. And then, so you felt the energy and lupus symptoms changing. Were there any other benefits as time went on for you?
My skin improved a lot. I have very, very sensitive skin, frequent breakouts. I'm always red and blotchy. And I mean, I can't be in the sun for more than 5 minutes without burning. And my skin definitely improved a lot as well, which was great. But
Good.
yeah, I think that was a big one.
That's really great. So how was there pain issues, inflammation of the pain with lupus? Is that joint pain?
Yeah. There. I mean, it was almost like that's just a constant part of my life, and I'd get really bad muscle aches too, and that is resolved. And I'm working out more than ever, which, you know, sometimes you'd expect more joint pains and everything from working out, but it's been great. Yeah, the pain has resolved. The energy has improved. Digestion is much better. Skin is better. There's so many benefits.
That's great. So since you're a doctor, a practicing physician, how do you share this with your patients, or how do you share this with your patients?
Right. Honestly, I read the patient a little bit first, kind of test where they're at. If they are plant-based mostly, I don't go there right away. It's more usually about controlling carbs and eating real food. And then as time goes on and patients add meat back into their life, we can have that discussion if they're not where they want to be. But yeah, no, I'll have patients ask about it, and by all means, then we can go forward. But it's kind of an individual approach, kind of feeling out the patient first before recommending it. The only patient population I do kind of strongly push it more is those with Crohn's disease, any type of irritable bowel or inflammatory bowel disease, and autoimmune disease, because I think the carnivore diet, there's nothing like it on the market that could help them more. So those I might push a little bit more.
Yes, it's such a great elimination diet. It's so sustainable. You could just stay, you can sustain yourself on it.
Yeah, yeah,
Do
exactly.
people with lupus seek you out? I know that's a really difficult
Mhm.
disease to manage.
Yeah, I've had a lot of people reach out to me on social media, on Instagram, and not just with lupus, rheumatoid arthritis, scleroderma, Sjogren's, a lot of autoimmune diseases in general. I've had patients reach out, which is really nice. I have a special place in my heart for them. I know their struggles, so I'm happy to help them any way I can.
Now, I think it sounds like things have just improved and there's a major difference.
Yes.
I'm curious also about the way your practice is set up now. I know that
Great.
it's
So
different than a typical practice.
yeah. Dr. Brian Lunskis and I are starting a direct primary care practice in San Diego, which is a membership-based model outside of insurance. And we'll have a special weight loss program and kind of a metabolic health program for patients who don't need a primary care doctor, but want a little extra guidance from a physician about this way of eating and appropriate testing in labs. So, for a monthly membership fee, we will take patients and take care of them and be able to spend up to an hour during visits, and they'll have access to us 24/7 through email, text, video conferencing, and pretty much we'll be able to practice medicine the way it was intended without hospital administrators and insurance companies getting in the way.
That's really exciting. What's the name of that
It's
business?
Low Carb MD San Diego.
Okay.
Yeah, if you put that in Google, our website should come up. Our website's still under construction, but it's functional. But if anyone has questions or wants to inquire about becoming a patient, they can email us, and that address is office@lowcarbmd.com. Or
Great.
I'm also on Instagram at Doctor and Keto. So we
Very good.
welcome people reaching out.
Well, that's great to hear. That's exciting to hear that new format, that new way of doing medicine, helping.
Yeah, we're
I
very excited.
I am wondering, what do you think that carnivore has, especially for women?
Yeah, so women are more complex, and it definitely depends on age as well, especially the perimenopausal years. But and there's just this, I don't know, social stigma where women don't eat red meat, and I definitely see a lot more males going towards carnivore. But I think carnivore is fantastic for females as well. And I think anxiety and depression, which is a common plague in women of childbearing years, a lot of them are on antidepressant and anti-anxiety medications. That improves significantly with carnivore. I've seen hormonal changes that are beneficial as well. Patients that have had PCOS and struggled with infertility improve pretty quickly on carnivore. And women during their reproductive years can get anemic very easily. And I think carnivore solves that most of the time. So I think it's a wonderful option for women.
Yeah, meat heals, doesn't it?
It does. Exactly.
Well, I'm really glad that you found your way to the carnivore diet and you're leading the way for a lot of people and helping people through that. So really appreciate
Thank
it.
you.
And I
Really,
really
really happy about it.
thank you for sharing your personal story. And
Yeah, and I'm happy to see patients who've also struggled with similar issues and are interested in this way of eating and working with the carnivore community. I think it would be fantastic.
nice. It's a great community. It's a growing community.
Yeah, yeah, I can tell. It's very impressive. It's and everyone's so supportive, which I think is wonderful, especially this day and age when there's so much ugliness in the world. To have a great community like this just fosters success.
Yeah. Well, thank you, Dr. Baier. I really enjoyed this
Thank
talk.
you.
Thanks.
You too. Take care.
And I'll see you out there in the carnivores.
Yes, sounds good. I look forward to it.
Okay, bye now.
Bye-bye.